Thanks very much. So for today's presentation, I had mentioned last week that we're really going to focus on Abbott BinaxNOW so that we can go deeper on this topic. As always, this will be recorded and posted on our website. So we really hope that those of you joining us live are able to get information, and those of you watching it later will also get what you need to know about this important part of our pooled testing initiative here in the state. For today, we got, I think, some really great folks lined up to bring us the information that you need in our partners in public health that you see on the right-hand side of the screen. So when I get done kicking us off, I'm going to turn it to Dr. Katie Brown, who is our state epidemiologist at DPH. She will then turn to Dr. Sandy Smoley, who is the Massachusetts State Public Health Laboratory Director. And then our colleagues from DPH will pick up, particularly Jeremiah Hay, our Senior Strategy Manager from the COVID-19 Command Center, before I take back over at the end of the presentation just to wrap up and talk about some important next steps for you all. So what are we trying to do today? A few important things. We want to make sure that we go back over what we know about BinaxNOW and why it's a useful tool to be using. And particularly that's what Dr. Brown will be talking about. Dr. Smoley will then delve into the study that we've been conducting here in Massachusetts. And we'll be glad to hear a bit more about that from her. Then moving more towards our protocol with Jeremiah. And then finally, I'll pick up, like I mentioned, about our resources and next steps. So I hope you'll find this useful today. Without any further ado, I'd love to just turn it over now to Dr. Brown. Dr. Brown, as always, just tell me when to advance the slides. I'll be glad to do so. Let me just make one more quick comment before I turn it over to Dr. Brown. We really want your questions today, and we'll make sure that we save some time for Q&A. Please just put them in the chat. We won't take questions kind of live on the spot, but Lauren is moderating the chat, and she will take over at the end to pose questions to any of us from DESE, Health and Human Services, and DPH. And so just keep your questions coming. I also want to reassure you that any questions we don't get to today, they will be considered for updates to our FAQ. So even coming out of Friday, one of our colleagues is actually working on updating our FAQ. So we'll be live soon with questions that you asked last Friday. We take your questions very seriously. We will do so today. So anything we can't answer today, we hope to be able to answer in our FAQ. So keep your questions coming. But for right now, Dr. Brown, very pleased to turn it over to you to give us more information about BinaxNOW and particularly this overview.
Great, thank you so much. Really appreciate the invitation to be here and delighted to have the opportunity to do a little bit of a deeper dive into the BinaxNOW than we were able to do on the call last week. We know that many of you have questions about the use of the BinaxNOW. This is definitely an expansion of the previous recommendations, and just want to make sure that everybody is comfortable with why we're making these recommendations now. So let's go ahead and go to the next slide. So I assume that all of you know at this point that there are really two primary types of tests that are used to diagnose current infection with COVID-19, and those are the PCR test and the antigen test. So PCR tests detect the presence of genetic material of the virus, and antigen tests detect proteins that are on the surface of the virus. So they both detect presence of virus, but by looking for different parts of it. So the Abbott BinaxNOW is an antigen test. It's rapid. It's considered a point of care test, which means you don't have to send the sample out to a laboratory, which is one of its primary advantages. So we view the benefits of the BinaxNOW test as opposed to PCR tests to be several. One of which is that it's relatively easy to use. Even among antigen tests, and there are several of them, the BinaxNOW seems to be agreed to be one of the easiest to use. And so these tests can be administered by any trained professional, including school nurses. As I mentioned, this is a point of care test, and so the results from a BinaxNOW are available in approximately 15 minutes, which means that when in 15 minutes, if you get a positive, it means you can jump right in and start contact tracing immediately. And then it's also very accurate in the circumstances in which it's being used. So it is extremely effective at finding individuals who have a high viral load. So, when you get infected with COVID, at the very beginning of your disease, whether you have symptoms or not, you have a lot of virus present in your upper respiratory tract, in your nose and back of your throat. As you go through your disease process, the amount of virus decreases, which is right. Your immune system is kicking up and taking care of the virus. What that means is that you are most infectious early on when you have the most virus up in your upper respiratory tract. And so the BinaxNOW tests are extremely good at picking up individuals who have that high amount of virus in your upper respiratory tract when you are most infectious. Next slide. So currently, schools are using BinaxNOW to test students or staff who have symptoms of an illness consistent with COVID. And again, that's because you can get this kind of very rapid result and take public health actions immediately in order to identify close contacts and quarantine folks. But in addition to that current use, the BinaxNOW is going to play a really important role as part of the pooled testing initiative that's being rolled out in K through 12 schools. And so when pooled test results, when a pool comes back positive, we're recommending and we feel comfortable that it is appropriate to use BinaxNOW to retest the members of that pool, all the people that were, contributed to that positive pool, individually, test them individually using the BinaxNOW to figure out who is the one or potentially two people from that pool who actually have the virus. Next slide. So Massachusetts is not the only state that's doing this. The Abbott BinaxNOW has been around for quite a while, and there's a lot more information on how the test behaves, what we call the test performance characteristics. And people are generally becoming much more comfortable with the use of Abbott BinaxNOW in multiple circumstances. And we're going to tell you a little bit in just a minute about a study that was done in Massachusetts that contributes to that comfort level. But I do just want to tell you about 3 other states who are also using it in relatively expansive ways. So Texas has already been using it the way we have to test symptomatic staff and students, but they are now planning to utilize, or their schools are now allowed to use it for more extensive screening testing. So screening asymptomatic individuals when there is a, kind of a high transmission level of COVID. In New York, schools who have a lab registration can request rapid tests to perform on their students, faculty, and staff. And kind of how frequently that needs to happen depends on local transmission rates. And Abbott BinaxNOW is the test that's being used there. And then in Colorado, they are actually now providing access to the at-home BinaxNOW tests, and schools are using that to test all students and staff that consent at least once per week. Next slide. So most of you should be familiar with this, but just to go quickly through them as a reminder. So there are several preconditions that schools have to meet in order to be able to use BinaxNOW in the schools. So you need a physician's order, a signed physician's order for testing. You need to be able to confirm that you have an adequate supply of PPE, and proper PPE for testing using BinaxNOW includes an N95 mask, although a surgical mask is allowable if an N95 is not available. You want to also use, in addition to the mask, eye protection and gloves and a gown when collecting specimens. Another precondition is to ensure that all testing staff have met the training requirements, which are relatively simple and easy to meet. you need to have parental consent and notification forms in place, and then also verify your ability to complete the DPH reporting required. Make sure that results are reported to public health. As a note, the CLIA certificate of waivers are no longer required. Each individual institution does not have to have those, but each school must still complete a brief online application form to be covered under sort of the umbrella certificate of waiver. And there will be a link to that later in the presentation if you need that. So I want to turn this over now to Dr. Sandy Smoley. Dr. Smoley is our State Public Health Laboratory Director, and she is a senior author on this really important study that was done in Massachusetts that helped us understand the performance characteristics of the Abbott BinaxNOW test. Sandy?
Great. Thank you, Dr. Brown. Good afternoon, everyone. I'm delighted to be here to share with you information from the study that we performed. So this study, DPH led this study to assess the performance of the Abbott BinaxNOW COVID-19 antigen card test against the comparator or gold standard assay, which is a real-time detection PCR. I'll stop for a moment before I go through the slides and just show you some of the components of the test. You may or may not have had a chance to really look at what these tests look like. And as indicated by Dr. Brown, the assay itself is pretty simple. It's probably the most simple on the market. Each of the kits come with 40 cards along with the a foam, sterile foam tip swab. They come with a small vial of the buffer that's used in the assay. And then each of the cards themselves are individually wrapped. I'm just going to pop one open here so you can see the card. It's basically like a butterfly, if you will. And you can see that on this side, you've got the strip where the test is performed. And then along the bottom here, you have two holes. The top hole is where the buffer will be dropped into that hole. It's laid flat. And then once the swab is collected, it's inserted into this lower hole and then turned. And then the card is closed and laid flat on the surface for 15 minutes. Here's what a card that's been used looks like, if you will. And so what will probably happen in some of your scenarios is that once the swab is collected, you'll likely put it into a transport carrier, such as an empty tube, break the end of that swab off, and then once you're at your location where you're performing your testing, perform the test, and it'll look something like this. So very, very simplistic and straightforward. So what I'm sharing with you today is, next slide, please. As you know, this test, and it's been reiterated several times, this Binax test provides more rapid results, 15 minutes in comparison to a PCR test, which is 1 to 2 days. And so what we really wanted to do is to make sure that we could accurately identify individuals with this rapid test. So for the study that we performed, we tested 2,482 individuals. That included 920, I think it's 928, I can't see, children. And for those of you who don't know, the children were not included in the initial package insert when they studied. So it's really important for us to really understand the performance of this test in children. So individuals gave verbal consent for 2 swabs to be collected and tested in parallel. So one swab went out for the gold standard PCR test, and the other swab stayed there on site, and the Binax antigen result was generated right there on site. This study was conducted at a drive-through testing site in Lawrence, Massachusetts. Medical personnel collected the anterior nasal swabs from individuals, both symptomatic and asymptomatic, and it included both children and adults. Next slide, please. So what is shown here is data from the study, and the PCR test itself it allows a measure of the amount of virus as determined by what's called a cycle threshold, or CT. And so what we show here is a comparison of 3 different pots, if you will, of looking at the data in terms of a cycle threshold that would represent a high viral load. So those are cycle thresholds that are less than or equal to 25. That's on the left-hand side. And in the middle two bar graphs there, you see what's called a moderate viral load. So viral load whereby the cycle threshold was less than or equal to 30. Then on the far right, what we would call low viral load, where you're seeing very little of the genetic material, and this is a cycle threshold of less than or equal to 35. So looking on the far left with the high viral load, when we compared symptomatic, that's the blue bar, to asymptomatic, the peach bar, 100% of the time we're able to identify, when you compare a Binax result to a PCR result, the virus in symptomatic, 98% of the time in asymptomatic for the high viral load. Then moving to the middle, 95% of the time in symptomatic. For the moderate load, we were able to utilize the Binax against the PCR, and 88% of the time for asymptomatic individuals. Moving to the far right, with fewer or lower amount of virus load in the clinical sample, it did drop. We did see still with symptomatic individuals 88% of the time, and then less so in asymptomatic 69% of the time. The bottom line is when you compare the PCR test to the BinaxNOW, that the BinaxNOW is very accurate in detecting COVID-19 in children when you're looking at moderate to high viral loads, even if they are asymptomatic. So these are the children that are most likely to be highly contagious and transmit the disease. So next slide, please. So just to recap the Binax benefits for pooled testing, we believe that the BinaxNOW offers a fast and accurate way to detect COVID-19 in symptomatic and asymptomatic children as part of this positive pooled test program. Across symptomatic and asymptomatic children, the BinaxNOW can consistently identify, as shown by this data, individuals with moderate and high viral loads who are most likely to be infectious. And certainly if you're comparing to the PCR test results of 1 to 2 days, the BinaxNOW can provide those results in 15 minutes and allow you rapid deployment of quarantine and contact tracing procedures. So given speed, accuracy, price, and its availability, we believe that the BinaxNOW is an effective way for this test to be deployed in schools, and we recommend it as the test of choice for the pooled testing program. So thank you. I'll turn it over to Jeremiah.
Thank you so much, Dr. Smalley. And I know that that's one of the biggest and best tests that's been done in the Binax, especially with children. So thank you so much for walking us through that. Hi, everybody. I'm Jeremiah Hay. I'm a senior strategy manager at the COVID Command Center in Massachusetts. And I want to take a couple of minutes to walk folks through the actual process steps involved in pooled testing and follow-up testing. And if I can suggest that if you're going to go forward with this program, you print out the next 3 or 4 slides and put them on the bulletin board of the office or something like that. I think it's going to be a really helpful reference for folks as we move into the program. And yeah, you can keep the slides rolling, Russell. Thank you very much. And so I actually want to start this though with a story. So I have an 18-month-old son who just started preschool. And as I've been working on this pooled testing with the state of Massachusetts, just out of nowhere this weekend, one of the parents at my son's preschool reached out to the rest of the parents and said, basically, here's what pooled testing is, and would folks be willing to pay in for pooled testing? And it was a good idea, and she thought through the detail on the pooled testing part of it in like just immaculately, and she'd given no thought to the follow-up testing. And I just cannot overstate how important the follow-up testing is to implementing this whole program, because finding out who's in a positive pool is really important, but that is useless unless you can figure out who in the pool was your positive individual or were your positive individuals. So really, really important, cannot overstate it. And let's just start at the very top here. So start at sample collection, that's gonna be once a week, and then the samples get to the lab. You can work with your assigned vendor to get that done through FedEx or something like that, or you can just take them over if that's easier. And then those pooled samples, so those 10 or so swabs in a tube are then tested at the laboratory using a PCR test. If that pooled test is negative, then everybody can keep learning and teaching without interruption, life as it was before the pool test. If that pool test is positive, then there are a couple things we need to think about. On the next slide. Thank you. And essentially the thing that we have to find out is who were our positive individual or individuals. And for the reasons that Drs. Brown and Smoley just gave, I mean, the results are 100 or 200 times faster than the PCR, and it's nearly as good, just about as good with the most contagious folks. We would recommend using the BinaxNOW test, but let's say that in your pool of 10, you're able to find 1 or 2 or however many people it is that were positive using your Binax tests. Then, okay, so those people and their close contacts should follow protocols around positive cases and close contacts, but everybody else can go back to resume learning or instruction in the classroom. If you have your positive pool and you run your Binax tests and you don't find any positive individuals, then that can mean a couple of things, and we're going to want to consider the options on the next page. So in many cases, what this will mean is that we just found somebody who was on the kind of very tail end of infection, and they actually are not testing positive for that reason anymore. And actually, if you do come back with a positive pool and no positive Binax, that suggests an individual who has a lower viral load who's less likely to be infectious. But either way, if that happens, and there are 2 things that you can do, and you really do get to choose which one you want. Either you can bring folks back in the next day or the day after that for another Binax test, or at that point, we've done our pool test, we did our follow-up test with the Binax. Now you can break over those individual PCRs to try to find the person or the people who might be positive. Whichever option you choose, here's what happens. If you don't identify any positive individuals, then the very safe assumption is that either you had a false positive at the pool test, or you had an individual who was positive when the pool test was taken, but is no longer testing positive. And kind of regardless, at this point, everyone's tested negative on an individual test twice, either 2 Binaxes or 1 Binax, 1 PCR, so we can continue learning our instruction without further disruption. And again, if you do find the positive individuals, whichever method you use here, A or B, then those people and their close contacts, should follow DESE protocols and DPH protocols around positive people and their contacts. And then just on the next page is one thing that's very important to know as you go through this. So we've had extensive conversations with Drs. Brown, Smoley, and others around whether we feel like it's necessary to isolate students who are in a positive pool before they have positive individual test results. And the answer is that we don't recommend doing that, which means that you can continue in-person learning or instruction until somebody in the classroom has a positive individual result. The fact that they were in a pool that tested positive isn't enough to pull folks out of the classroom. But if 1 or more people test positive on an individual test, then obviously they should follow protocols, and so should anybody that was a close contact. And I do want to say the bedrock of that assumption is that students and staff have been following recommended precautions, masks, social distancing, hand washing, things like that. And if they are, then there's no need to isolate until you confirm the positive folks using individual tests. And so I think that's it for the process. I'm sure that there are a bunch of questions. I will happily take them at the very end, and hopefully some of them are answered if you dig deep into our Q&A. So I think that's me. Russell?
Great, thanks, Jeremiah. And so let me just turn my video back on again. So thanks very much, really appreciate that. And to all of our speakers today, this was very useful, and I'm sure that we will get into more specific details in the questions that will come up in the chat. But we want to just talk through some resources. A little bit of this is a reminder from our webinar from last week, but there is some new information here. So please pay close attention to these details, because they all matter to get us to that point of being able to launch this in early February. So thank you for just leaning in on this part of the conversation as well. So just to start with, thinking about what Dr. Smoley told us about the study that was conducted in Lawrence, we have 2 links for you. First, the full text of that study, as well as the abstract. And so particularly, if you want to delve into this further, look at the data in the study further, please use those links and take a look. We're also pleased that our colleagues in Arizona, in Pima County, Arizona, also conducted a study that, as you can see, found very high rates of effectiveness, so 92.6% effective at identifying infectious people who are symptomatic, and about 80% when they say they're asymptomatic, including a pool that had both children and adults in that pool of about 3,400 individuals. So again, just glad to bring the research to you, and particularly the Massachusetts-based research that we are very encouraged by for the use of BinaxNOW. So this is what we talked about last week, and there are some things though that I want to make sure that we update for you today. So this is our first page of 2 about our resources. And just that reminder that we talked about at the beginning, that if you haven't started the process, please do so now to get approved for BinaxNOW and to get those kits being shipped to your school locations, to your district location actually, and then you actually spread out and disperse throughout the district. But here are the steps. Just a reminder that we now have the statewide CLIA waiver instead of the individual site-based CLIA waivers. So that's good news, and I'll say a little bit more about that in a minute. The signed physician standing order, this is very important. We have an update for you today about the signed physician's standing order, so that is necessary. But I want to say a little bit more about that in just a second. The PPE that's necessary, and then the consent forms that you need, all of which are on the links that you see on this page. And so we hope that you will use them to get what you need. And as always, we really appreciate that you're sending those checklists, as well as any questions, frankly, to the email address that you see at the bottom of this page. So just moving on really quickly, and before we get to the next page about resources, I just want to talk about the updated physician standing order just for a second. And what's important to know about this is that we have updated the standing order. So if you are already using BinaxNOW, I want you to just really know and be ready to follow up and get a new standing order that you'll have to have signed for using BinaxNOW for pool testing. Here's why. There are certain instances where some of the professionals who will be conducting pooled testing need to have a doctor's standing order in order for them to actually administer the pooled testing. If they're observing the pooled testing, remember that's an option. You do not have to have someone directly administering the pooled testing in your schools. But there are many scenarios where we can imagine direct administration of pooled testing occurring, including supporting students with more significant disabilities, for example, who might not be able to self-swab, younger children in particular, where it will need to be administered. And so we've updated our physician standing order so that it includes those instances where a healthcare professional might be administering the pooled testing. And it will also continue to cover the BinaxNOW administration, because that is at this point not self-administered. And so any type of, again, the idea of using BinaxNOW where you're getting individual results, and any type of administered testing is what's covered in the updated physician standing order. Take note that it is not up on our website yet, but it will be. Perhaps later today, we're saying likely tomorrow, just to overpromise and overpromise and make sure that we don't say that we're going to do it today if it just happens to be tomorrow. But it is coming, and just know that we'll need you to, and we'll put this in kind of a big headline on the pooled testing website, as well as the BinaxNOW website, just to remind people that that physician standing order, if you already have one, there are 118 schools and districts that already are receiving BinaxNOW kits for pooled testing. If you're interested in switching to pooled testing, you will need to get that updated standing order. So I hope that doesn't create too much of a challenge for you. Clearly, we appreciate that you found an avenue to get that pooled testing signed once. The standing doctor's order, standing physician's order to be signed once. Hopefully it won't be too hard to get it signed again with this updated information. So back to the resources, just a reminder about the statewide CLIA waiver. This is not new. This is what we talked about on Friday. We do have this ability for districts to essentially sign on to a statewide CLIA waiver, and you do so by completing the survey that we have the link for you on this slide. And as always, I know that Lauren has been putting the copy of these slides into the chat, and we will also have them on our website. This is not new information from, again, we presented this on Friday, so nothing is new or different there. So just a quick reminder on next steps. And again, this is a quick repeat on what we talked about on Friday. If you haven't done so, please sign up for BinaxNOW and get that approval for implementation. And again, there's the link to be able to do so. And then just making sure that to be ready for a launch in early February, please complete the authorized school application and statement of assurances at your earliest convenience. Keep in mind that it's all done, both the application and the statement of assurances are completed by taking clicking on this link to this survey. So by completing the survey, you are able to get us both that application and statement of assurances. Also keep in mind that we very deliberately put the documents that you have to download and get in, fill out information with the statement of assurances. You need to get a wet signature on it and re-upload it. With the application, we need to get detailed information about each school location that will be administering the pooled testing. And so we prompt you to give us those two documents first before you go on to some other questions in the survey. So we just hope that you will take some time to complete that, but also if you can do so by this Thursday, we will make sure that you are prioritized for the matching process that we're frankly already having discussions about. As we see these completed forms coming into us, it's already helping us know and start to think about how we can match districts and schools with vendors. So that's a big, large piece of work that we will be undertaking for the rest of this week and in the weeks ahead. As long as we're getting your finalized documents, we will keep on with the matching process. And so thank you for the work that you're doing to make sure that we get what we need in order to match you with a vendor and get you going. So then finally, just that reminder that our state start date is mainly starting the week of February 8th. And schools and districts that don't need as much support right out of the gate will be able to start the soonest. So those that don't need as much in the way of the kind of on-the-ground support for operational oversight or administration of the pooled testing will be able to start the soonest. But we're very committed to providing those resources. So we will make sure that we get everyone going as quickly as we can. And then keep in mind that it might take you a little longer to get us the paperwork that we need. And so we're going to continue to just do that matching as your documents come into us through the week of March 1st. So you can continue to apply throughout the month of February. And then just that final reminder that we will be posting our statewide contract in the coming days ahead, so that by early to mid-March, that contract will be available so that you can purchase services off of them and keep these pool testing operations going beyond the end of our 6-week early launch. So I hope that's just a helpful reminder. I know that you all have a lot on your mind, so thanks for kind of bearing with me as I repeated some of the information from Friday, but I can imagine that it just might be helpful to hear it more than once because everything is a lot to take in right now. And so appreciate your work on this and your kind of diligence in getting all of the steps completed so that we can launch as soon as we can. Finally, just a quick reminder that on Friday, we're very pleased to have a webinar focused on implementation strategies. If you recall, last Friday, in the memo that we released, I skipped over a lot of the implementation details, mainly because I wanted to spend that hour focusing on the application process. What does it mean to apply and be approved as a school or district that will be able to receive those services? So hopefully you're spending the early part of this week focused on that. We really want to be able to then delve into this idea of implementation further. On Friday, really pleased that we'll have representatives from the Shaw Foundation with us to talk about what they have learned and how they can offer support with implementation going forward as well. And so that is, again, this Friday, the 29th from 1 to 2, and the link is there in the slide for you to be able to use just like you got here today. So we're hopeful that we'll see you back on Friday with your ideas and questions, as well as to be able to hear some very timely information from us as well. So that's really it for today. Lauren, I'm glad to turn it over to you now to see what questions we have, and thanks for directing them to any of the speakers who were able to join us for this webinar today.
Great. So there are a few questions about the statewide CLIA waiver. Jeremiah, if you could take these. So folks are wondering if they have already been approved at one site in their district, but now want to expand to other sites. Do they need to fill out the survey for those schools?
Yes, you do. But just to be clear too, there was a CLIA waiver application fee of $180 in the old model, and that does not exist anymore. course, there's not going to be a fee associated with that. But you can add new schools to the state's certificate of waiver, to the state's CLIA waiver with that form.
Great. Dr. Smoley and Dr. Brown, there are questions about the false negatives for the BinaxNOW test and whether or not they should be, whether negatives on the BinaxNOW should be considered true negatives, thus safe for returning to the classroom. And so could you describe a little bit more about what the protocols are if schools receive a negative on the BinaxNOW test?
Katie, do you want to go ahead and take that?
Sure.
I'll follow up if needed.
Okay, sure. Yeah, so this is a great question, and PCR tests are more sensitive than antigen tests, right? And what we have learned about them during this pandemic is that they can detect even, really tiny amounts of virus, which may be present for a very long time after somebody is actually infectious. And so what I think we want people to understand about the BinaxNOW antigen test is that the quote false positives are really the PCR test picking up kind of tiny amounts of residual virus in people that are no longer infectious. The BinaxNOW test is very effective at picking up that larger amount of virus which is present when someone is infectious. And so it's identifying the most important cases because they are the ones that are contributing to transmission. Sandy, do you want to add anything?
No, just
to that?
add everything exactly except I think you meant to say false negatives. So
I'm sorry, my apologies.
The false positive rate for this assay is extremely low. We were delighted to identify that in the study as being, like 4 out of 1,000 tests that we've done. So very, very low. The false negative rate, as Katie indicated, we really honed in on the amount of virus that is the infectious part or the period of time in a person's course of illness that is of importance, either early on or that first 5 days or so, but really looking at that cycle threshold value as a measuring stick. And I think because we had that data to compare this assay to, we have a great deal more confidence than we would have otherwise in its utility as a tool in this particular scenario. Does that help answer the question?
So I think the answer to the question, the short answer, that was the rationale for it, but the short answer is yes, you should trust a negative from an Abbott BinaxNOW test.
Great, thank you. So there were a few questions about how to conduct and when to conduct the reflex testing, where to conduct the reflex testing, and just want to remind folks, Russell, if you could share your screen again about our presentation on Friday that will go over implementation for pool testing. And we will also go over scenarios for reflex testing, where to conduct the tests, when to conduct them, how to conduct them. So if you do not already have this flagged on your calendar, please mark this down and we will review those questions then.
One quick note for folks, reflex testing and follow-up testing are synonymous. So you might hear those used interchangeably. They're both just the individual tests that are provided in response to programs.
Great. So there are questions about clarifying again, who is allowed to conduct the Abbott BinaxNOW test. Does it have to be done by trained school staff? Does it have to be healthcare professional?
It does not have to be a healthcare professional. It just needs to be an individual who's adequately trained. And part of the documentation that will be provided to you is a training document that you should both perform and keep a copy of on site.
Great. Questions about are the BinaxNOW tests considered biohazard and how do they dispose of it?
Do we have that in an FAQ? Jeremiah or Katie?
Yeah, that's certainly in one of the memos that's out there. The answer is that the used tests are considered biohazard waste, and there's like a red bag system. And I would hope most schools or districts are either have something set up with their facilities folks or are going to be able to set something up in short order. If that does prove to be a stumbling block, please let us know. Try to troubleshoot with you.
Great. Russell, this one we got yesterday from an email that we spoke about, but hoping that you could clarify. So people are wondering, sorry, so the potential conflicting statement in the statement of assurances about quarantining, and then the protocols to have members stay home from school. But then having the positive pool come back to do BinaxNOW testing. Could you clarify those two statements for us?
Lauren, do you want to start it actually, and then I'll follow up?
Sure. So in the statement of assurances, it has districts and schools attest that they will have an appropriate place to provide isolation and quarantining for members in the positive pool who test positive on the reflex or follow-up testing. And so we are not asking, as Dr. Smoley reviewed, or sorry, that Jeremiah reviewed in his portion, positive pools do not need to quarantine until they potentially test positive on the reflex or follow-up testing. So there are two different protocols there that we're referring to in those documents, and they are not, we don't believe them to be conflicting statements. Russell, anything to add to that?
Yeah, Lauren, I was just actually using that time to call it up real quick just to show it to everyone. So what we're talking about is that the testing protocol section of the assurances is here. And this other section is about isolation, quarantine, and contact tracing. And so the question that we received yesterday that Lauren's mentioning was, if you read this section here without understanding that it's under the heading of isolation, quarantine, and contact tracing, you might think that it's really about follow-up testing. So again, if you have someone who has a positive result, then you have to have the protocols in place, the isolation, the quarantining, the contact tracing to follow up on that, as opposed to reading this to say that these are the steps that you have to take to determine if you have a positive result. So again, I just think the important thing with this is just to pay attention to the headings that the assurances describe, so that you just don't fall into what could be an easy confusion if you read it without the headings, essentially.
Great, thanks, Russell. There was a question about the consent forms and whether or not, if you are participating in the pool testing program, do you have to do the BinaxNOW consent forms and the pool testing consent forms? The answer to that question is we have, if you are administering the BinaxNOW test as part of follow-up testing with the pool testing program, please use the consent form for the pool testing programs. We have combined them so that you are asking for consent to participate in pool testing as well as follow-up testing should that individual be part of a positive pool. So if you're only participating in the symptomatic BinaxNOW program, you will use the BinaxNOW consent forms. If you are administering pool testing, then you will use the pool testing consent forms. And so we have outlined that in both of our documents on the BinaxNOW page, as well as on the pool testing page of the DESE website.
And again, here's the,
Russell, do you want to, yeah.
The form itself, and we put on, in the form, in this section about consent, what parents are consenting to, or in our other consent form, that the individuals who can consent for themselves has very similar information, but it includes that, you are consenting for all of the, both the pool testing and the follow-up testing as well. So it's on the form itself, and it's again labeled the COVID-19 pool testing consent form. So make sure that you're directing your staff to that form to get them, if you're doing pool testing, like Lauren said, make sure you're using this form. And again, it is translated on our website.
Great.
Right now,
There's a question. Oh, go ahead.
No, translated into Spanish right now. Lauren, other languages to come?
Correct. Yep, other languages to come, and we'll have them posted on the website as well. So there's a question about the reporting of results and whether or not the results that get reported to DPH will then be entered into Maven so that the contact tracer in the town where the individual resides can take over contact tracing.
Yes, excuse me. Yes, the answer is absolutely. And so it's long as the school is set up to report using the approved mechanism, the results do go into Maven and are sent automatically. Actually, as soon as they're in Maven, they are available automatically to the local Board of Health for case investigation and contact tracing.
And just one add on there, thank you so much, Dr. Brown, is that I just want to be very clear about what needs to be reported, and those are the individual tests. So whether it's a Binax, or actually in the case of a PCR, a lab should do the reporting, but you're going to have to put in information about the individual who got tested. Those individual test results need to go to DPH. The pooled test results, so if you're getting your positive or your negative at an aggregate, those don't need to go to the Department of Public Health, and they don't trigger contact tracing.
Great. Can you let a student from a positive pool ride the bus to complete reflex testing in school?
So again, our advice is that if you are part of a positive pool, it does not mean that you immediately have to be isolated and quarantined. Dr. Brown, do you want to say anything more about that?
No, that's exactly right. We're not treating people as cases until they are confirmed as cases. Can I just say one more thing related to that? So several months ago, the New York Times did a nice article about COVID and sort of all of the different protective layers, public health prevention methods that can be put in place. And what they did was show it as slices of Swiss cheese, right? That no single public health intervention is perfect, right? And it will have holes in it. It's not going to be perfect. But when you're doing everything together, when you're taking all those pieces of Swiss cheese and layering them on top of each other, you end up with a solid piece of cheese, and the COVID doesn't get through. I'm sorry, I like that analogy. I hope that works for other people as well. So again, this is just another layer of Swiss cheese, and it's one that actually doesn't have very many holes in it, but it's another thing to add to this layer of protection on top of the social distancing and the masking and not coming to school when you're symptomatic and washing your hands and all the other things that are associated with it.
And I might just add that the way that we think about our guidance is that we set the floor, and it's a high standard for safety. But if districts feel like they need to take further measures, they can go beyond our safety measures. And maybe at the beginning, they want to set some additional safety features in place, set up some additional safety features that ultimately you might be able to kind of, bring down a little bit, bring back to our standard over time. And that's acceptable. You can certainly have more kind of restrictive requirements than what we recommend. But you just know that what we're recommending, we stand behind. We feel very strongly that this is actually evidence-based and in keeping with public health standards.
And I'd actually love to add one more thing there too. And thanks, Dr. Brown, for reminding us all it's lunchtime. Is that nothing that we've said here or in the symptomatic testing guidance should be taken to suggest that somebody who's symptomatic should come into school for any reason. So that should be an overriding truth that regardless of whether they were in a positive pool or a negative pool, or whether you're doing symptomatic testing or whatever you're doing, you're not saying and would not recommend that any symptomatic individual come into the building, right?
Jeremiah, I'm really glad you said that. That's a really good point. We wouldn't want that student getting on the bus if they had symptoms.
Great. There are just some questions about how will we follow up with districts and schools about the information that was shared in this webinar. All of the information, including an updated FAQ with the questions that were sent to us in the chat, will be updated on our pool testing website, and I'm just going to put that link right in the chat. So please continue to go to that page on our website to download the materials and look for the date next to the documents, and you'll see when they've been most recently updated. But we will be providing an update to the FAQ, as well as posting these slides and the recording from this webinar on that page. I think those are the substantive questions that we've gotten so far in the chat. And so Russell, I don't know if you have any last closing words.
No, just hope this was helpful for you today. Keep your questions coming, and we will look forward to seeing you on Friday. And in between, we hope to see as many of your completed statement of assurances and applications as well, so that we can continue on with the matching process and get you started in as early in February as possible. So thanks so much for being with us today. We'll look forward to seeing you on Friday. Have a great rest of the week, everyone.